Today I would like to educate all of you on gum diseases and sensitivity problem. This is an international problem. 200 crores people, that is 2 billion people, are suffering from this problem throughout the world. In India, we have at least 45% people suffering from gums problem. What is gums problem? How does it start? We must know. This is because of poor oral hygiene. People do not brush properly. As the data says, 91% people in the world, they do not know how to do correct brushing. Once we do not brush properly, some plaque-like thing, which is saliva, food particles and bacteria, they make a slimy layer on the teeth surface. If you do not brush at night, next morning you just move your tongue on the teeth, you will find a slimy surface. This is called plaque. This plaque usually accumulates more near the gum margin. This accumulates and becomes thicker layer. Ultimately, it becomes calcified, which is creamish in color, then becomes grayish in color, in some cases becomes brownish in color. This layer, which you find in this photograph, it is not there, but here is the enamel of the tooth, there is a crown. At the crown margin, near the gums, this thing is there. And this irritates the gum portion. Once irritates the gum portion, the gum starts becoming red. This is the start of the gum diseases. Here we can see the gums little red over here. In the next picture, which I would like to show you, in this picture, this probe is going deeper. There are periodontal fibers which attach the tooth to the bone. These fibers get damaged. The infection, trauma, injury, inflammation, they make the gums red and gums start bleeding. The calculus deposit, which I have just mentioned, once it becomes calcified, it gets covered with the swollen gums. This comes under the gums and gums cover this area and there is a more irritation while eating food. In this photograph, if you see, this probe has gone further down in the gums portion and gums have become red. Here if you see, the gums are becoming red around the teeth. Now this gum problem, this makes the periodontal fibers damage and the pocket is increasing further, and as well as the bleeding from the gums also increases. In this particular photograph we see there is a calculus deposit over here as well as the gum recession. Here also we can see the redness and the gum recession. Here we see the probe going further down. This is the bone. Bone is also resolved because of the pus formation. So in this case, the complete gum is swollen. The tartar deposit is under the gums and the gums start bleeding. Once the gums start bleeding, you will find people have complained the foul smell in the mouth, painful gums, bleeding gums. They cannot eat any food properly. Even the banana, which is one of the very soft fruit, when they bite, they see the red stain on the banana. This is because of your gums problem. Gums problem is linked with the sensitivity of the teeth. As I told in this picture, when the gums is damaged, periodontal fibers is damaged, the roots are exposed. The roots are sensitive to hot and cold sensations. Sometimes the gum recession takes place, gums recede, they come down and the roots are exposed. Patient gets the hot and cold sensations. Sometimes sensations are so severe patient cannot breathe. Once you breathe, you find your cold sensation. You can't take a hot cup of tea. This is a very, very painful thing. Gums are swollen, gums are red, and there is a foul smell in the mouth. That we call halitosis. The bleeding gums, patient come to me, they have a lot of bleeding in the gums, painful gums, they can't eat food. If it is not treated, the infection goes further down, teeth become loose, that we call it a pyorrhea. Pyorrhea is the pus formation along the roots, along the bone surrounding the tooth. Teeth become loose and they fall out. It's a painful situation. I have seen a patient in a very young age group, they are losing teeth, they can't eat food. If we brush properly, morning, evening, visit dentist every 6 months, get proper checkup done, there are less chances of gums problem. Sensitivity can be treated either with the root canal treatment or with the desensitizing chemicals, medicines, as well as desensitizing toothpaste. This is advised by the dentist. The scaling has to be done. The calculus deposit which I just mentioned has to be removed. Gums become normal, the swelling reduced, bleeding reduced, and gums become normal. If gums are still swollen, then gum surgery has to be done by the dentist. Teeth become normal and they look very healthy.